Okay, Assalamualaikum. Assalamualaikum. So we are from Group 12, and today we're going to present MNT case study 4, and this is our group members. Okay, so my name is Athirah Farhana, and I'm gonna be the first presenter for today. And this is our case study 4. This is the situation. And for this case study 4, I've listed out a few clinical signs of malnutrition for Jane. And first is Jane has been diagnosed with stage 2 colon cancer. Prior to the diagnosis, Jane reported weight loss and along with loss of appetite and dysphagia. She also have a dry mucous membrane on her mouth due to the dysphagia. That's all from me. Thank you.
Assalamualaikum. I am Izzati. I will continue the previous presenter. Okay, first one. First potential effects of colon cancer is diarrhea and constipation. Second one, changes in bowel function. Third, changes in bladder function. Next, fitness or fatigue. And the last one is shortness of breath. Shortness of breath ni boleh berlaku apabila cancer cell tu dah spread to the lung. Dan sebab colon ada dalam GI tract, that is why diarrhea and constipation also relate dengan colon cancer. And diarrhea and constipation ni boleh juga lead kepada weakness. Next. Next, treatment on patient's nutritional status. First, chemotherapy. Chemotherapy use is FOLFOX, which is a combination of chemotherapy drugs, and doctors commonly use it to treat colorectal cancer, particularly if it has spread beyond the colon. And the negative side effects of chemotherapy is anemia, fatigue, nausea, vomiting, loss of appetite, changes in taste, dysphagia, and also diarrhea. Next, radiation therapy. It is not common use to treat colon cancer, but it may be used in certain cases, such as before and after surgery, which is before surgery. It can help to shrink a tumor and make it easier to remove, and after surgery, if the cancer has attached to an internal organ or the lining of the belly. Third one is immunotherapy, that uses very specific drugs to help the immune system to destroy cancer cells. And the negative side effects of immunotherapy are fatigue, fever, flu-like symptoms, and decrease in food intake. And the last one is surgery. Surgery can be done for if there are only a few small areas of cancer spread in the liver or lungs, and they can be removed along with the colon cancer. And the negative effects of surgery is fatigue, pain, and loss of appetite. So that's all from me. Thank you.
Assalamualaikum warahmatullahi wabarakatuh. I'm the next presenter, Muhamad Firdaus bin Supian. My part is illustrate a nutrition care process for this patient to prepare her for surgery. I will use the SOP technique. So for the subjective, she is a 55 years old woman with loss along with loss of appetite and dysphagia, stage 2 colon cancer. So for the objective, anthropometry, her weight is 51 kg, the height is 1.58 meter, and her BMI is 20.43 kilogram per meter normal. Her biochemical hemoglobin is 11.6 and her albumin is 4.3. Clinical stage 2 colon cancer, dry mucous membrane of the mouth, dysphagia. And for her dietary, I already count for her energy requirement. So her energy requirement is 1838.4 kcal. Jane take 3 times meal per day with 1 time morning snacks. Second, Jane take sweet drink once per day. And the last one is Jane have balanced intake for fruit and vegetable. That's all from me. Thank you.
I am Corina Langkitni, the next presenter. I will continue to present the nutrition care process by using SOP method. So here we can see the assessment. First, lost appetite related to the dry mucous membrane of the mouth, as evident by the weight loss of 5 kilograms. Next, undesirable food choice related to stage 2 colon cancer, as evident by weight loss of 5 kilograms. Lastly, inadequate food and beverage intake and nutritional deficiency relate to the loss of appetite as evident by low hemoglobin, which is 11.6 grams per deciliter, and inadequate balanced diet. Next, the plan that can be conducted. First, review and re-evaluate at 6 weeks to 3 months. Talk about the basic knowledge of stage 2 colon cancer and dietary management to the patients. Lastly, do monthly body checkup to monitor her BMI status, hemoglobin level, and also albumin level. That's all from me. I will pass this to the next presenter. Thank you.
I am the next presenter, EE, which will present for the question 4, which is include a meal plan and dietary strategies in managing cancer side effect. So for the BMI of the patient, it is found that 20.43 kg per m square, which is normal BMI. The energy requirement 1838.4 kilocalorie per day. For the protein, carbohydrate and fat distribution, it is calculated at 285.6 kilocalorie per day, 992.68 kilocalorie per day, and 551.49 kilocalorie per day respectively. So this is the food distribution table. So it is consists of 2 exchange of milk, 3 exchange of fruits and vegetables, 5.8 exchange of grain, 2.3 exchange of meat, and 7 exchange of fat. This is the meal plan. As we can see, it is recommended to have 1 glass of low-fat milk, 1 tablespoon of raisin, 4 slices wholemeal bread, and 2 tablespoons of cream cheese as breakfast. For lunch, it is recommended to have 1 cup of dark green leafy vegetables, 2 cups of cooked white rice, 2 pieces of chicken drumstick. And for the tea time, it is recommended to have 1 cup of yogurt, 4 whole potato, and 3 teaspoons of butter. For dinner, 2 medium size of banana and 1 cup of raw ulam is recommended. For supper, 16 large black olive is suggested. So I'll pass the dietary strategies to the next presenter, Nurdini.
Okey, untuk next part, saya Nurdini akan membentangkan part dietary strategi lah. Okey, sebagai mana kita tahu, patient tadi dia ada mengidap dysphagia. Dysphagia ni adalah masalah untuk dia menelan makanan. Jadi, selalunya terapis akan membuat beberapa terapi lah untuk dia boleh mengunyah dan menelan balik makanan-makanan yang dia tak boleh makan lah sebelum ni, macam makanan keras ke apa. Okey, yang pertama kita ada terapi swallowing therapy yang ada shaker exercise, yoke lip maneuver, effortful swallowing, supraglottic swallow, supraglottic swallow maneuver. Okey, dan di antara kemudian antara terapi ni dia akan diperkenalkan juga dengan level diet. Level diet untuk dysphagia ada 4. Level yang pertama dia akan diperkenalkan dengan makanan yang lembut. Seperti yogurt, mashed potato dengan gravy dan juga sup. Dan level yang kedua, dia akan diperkenalkan dengan moist food, yang mana moist food ni dia ada perlukan untuk mengunyah juga, tapi tidaklah terlalu banyak. Dia hanya mengunyah sedikit lah, macam sedikit mengunyah. Sebagai contoh makanan tersebut adalah seperti soft scrambled egg, mashed fruit or vegetable dan juga cottage cheese. Untuk yang level ketiga pula, level ketiga, dia akan diperkenalkan dengan makanan soft solid. Okay, level yang ketiga dia akan diperkenalkan dengan makanan soft solid yang dia memerlukan untuk chew lebih banyak kali lah. Sebagai contoh, meat pun bukan meat yang besar sangat, fruit, vegetable yang easy to cut ataupun mash lah. Itu yang level ketiga. Level yang keempat adalah di mana dia boleh memakan semua makanan yang dinyatakan sebelum ni, dan juga dia boleh juga slowly untuk makan makanan yang keras, macam cracker ke apa ke, dia boleh slowly makan benda-benda tu. Okay, untuk next pula, bagi yang penyakit untuk colon therapy ni, diet plan dia, dia perlu meningkatkan pengambilan sayuran dan buah-buahan yang mengandungi tinggi vitamin D, selenium, zinc, iron, vitamin C, vitamin E, folic acid dan juga elektrolit. Sebabnya, nutrien-nutrien ni dia membantu untuk mengembalikan kebolehan untuk digest dan juga absorb makanan. Kemudian, dia juga disarankan untuk mengambil omega 3 suplemen. Dia juga untuk yang pengidap penyakit kolon kanser ni, dia perlu limitkan fiber dan juga laktos sebabnya kadar penyerapan usus kolon kalau bagi penyakit kanser kolon ni dia dah berkurang. So, dia perlu limitkan pengambilan dia punya fiber dan juga laktos. Untuk pengidap kolon kanser ni juga, dia perlulah mengamalkan gaya hidup sihat dengan melakukan aktiviti seperti senaman. Untuk umur yang pasien yang 50, dia pada umur sebegini, aktiviti yang sesuai untuk dijalankan adalah berjalan kaki dan sekurang-kurangnya 30 minit sehari. Jika dia tidak boleh 30 minit, 10 minit pun sudah membadai. Okey, itu sahaja daripada saya dan juga ahli kumpulan saya mengenai kes study yang keempat ini, iaitu diet terapi untuk pengidap penyakit kolon kanser dan juga disfagia. Itu sahaja daripada kami. Sekian, terima kasih.